Good evening, Vijetha ma'am. Shall we start, ma'am?
Yes, we will start.
Sure. Thank you. Good evening, one and all. I, Dr. M. Vijay Karthikeyan, National Treasurer of IAME, feel very much privileged to welcome you all for this engaging panel discussion on the topic Reimagining Biochemistry, Engaging Core Concepts with Clinical Relevance. Today we have with us four eminent panelists who will be sharing their insight on this important topic, and we have an excellent moderator, Dr. Vijetha Shenoy Belle, Associate Professor, Department of Biochemistry from KMC Manipal. Over to you, ma'am. You can just take over.
Thank you, sir, for kind introduction. Good evening, one and all. So we all know that biochemistry forms the foundational bridge between the basic science and clinical practice. Yet, it is often perceived as an abstract or disconnected from real-world healthcare. But this is not true. That's why we have organized this panel discussion, Reimagining Biochemistry, Engaging Core Concept with Clinical Relevance, which aims to explore innovative approaches to teaching, learning, and applying biochemistry in ways that are meaningful, integrated, and clinically oriented. To address all these, we have expertise and in biochemistry as well as in medical education, and it's my privilege to introduce all the panelists to our audience. Dr. Neelam Patil, Professor, Department of Biochemistry, Topiwala National Medical College and Hospital, Mumbai. Welcome you, ma'am.
Thank you. Thank you, Vijetha ma'am.
Dr. Sangeetha Kandasamy, Professor and Head, Department of Biochemistry, Government Medical College, Villupuram, Tamil Nadu. Welcome, madam.
Good evening, ma'am. Good evening to all. Thank you, ma'am.
Dr. Manju M, Professor and Head, Department of Biochemistry, AVMCH, Pondicherry. Welcome, ma'am.
Thank you, Dr. Vijetha, and thank you all who are attending.
Dr. Onjal K. Taywade, Additional Professor, Department of Biochemistry, AIIMS, Jammu. Welcome, sir.
Good evening all, and thank you, Dr. Vijetha.
The aim of this panel discussion to inspire a shift from rote memorization towards conceptual understanding, critical thinking, and lifelong learning. By reimagining how biochemistry is taught and applied, this panel seeks to strengthen its role as a clinically relevant and intellectually engaging discipline that directly supports improved patient care and medical innovation. With this background, let's start our panel discussion. My first question to Dr. Manju, madam. Madam, how did biochemistry emerge as a discipline in India and what were their early roots?
Okay, thank you for the starting batsman, I suppose. So let's start with the history. If we speak about the emergence of biochemistry in India, it emerged gradually actually during the late 19th centuries and the early 20th centuries. And it initially grew out, when I searched the literature, I could get that biochemistry initially grew out of two major disciplines of related scientific disciplines. They were physiology, and the second one was agricultural chemistry, both who adopted chemical principles in biological systems. Then the next influence was many of our scientists, Indian scientists who went to UK, they got training in particularly and came back and they started research related to biochemical phenomenon. Then the very next thing that happened was in the early 1920s to 1940s, there were establishment of the biochemistry departments, not in medical colleges, but in other major, very famous institutes like University of Calcutta in 1920, then Indian Institute of Science in Bangalore, and followed by 1970s only, our medical colleges started taking it. So coming to then, there are major, coming to our field in medicine, if you see, till 1970s, okay, it was actually, we know that it was taught as a part of physiology. So it was called as physiological chemistry or it was called as chemical physiology. Okay, I just went through the portions also. It is covering the basic biomolecules, etc. Then came the year 1977, actually was the major year when Medical Council of India, it has revised the MBBS curriculum, and they have established our biochemistry as an independent department in 1977, with dedicated faculty positions were allotted and laboratories were made compulsory for in the teaching side, in the college side, as well as for the diagnostic services. Following this, many hospitals, if you think GS Safe Medical College, Mumbai, then KEM Hospital, St. John's, they were the earliest to even form a biochemistry, because there was no biochemistry MDs and all. So physiology people started taking in the initially. Later on in 1997, the major curricular revision of MBBS happened, and we became one of the major 3 foundational subjects along with anatomy and physiology for as a preclinical subject. And we were a major contributor to the clinical laboratory services in teaching hospitals too. Then came in 2019 our CBME, where our status as an independent subject in phase 1 MBBS were a little more strengthened by giving more structured competencies like molecular base of disease, laboratory medicine, quality assurance in lab, then early clinical exposure, clinical relevance, etc., etc. And this is how our biochemistry, and before MBBS came itself, our MSCs were BSc and MSc biochemistries were started in various institutes throughout India. This is in nutshell how our biochemistry came into India, and how it became one of the disciplines in MBBS, followed by MD.
Vijetha madam, can you please unmute yourself?
Sorry. Thank you, ma'am. Thank you for that initial the history of our biochemistry. Now the question to Dr. Sangeetha, ma'am. Ma'am, can you tell us from your experience how the role of this biochemistry has evolved in undergraduate medical education over the last decade?
Thank you, ma'am. Very nice questions. Actually, it is a continuation of this previous questions also. We can take it in such a way. I perceive that it is before the CBME and after the CBME. We can differentiate easily with the competency-based medical education from 2019. Before that, we can call it as a traditional curriculum. So the CBME curriculum, it is prescribed by our National Commission of India. It's a very well established 84 competencies and 14 topics along with 11 certified skills. So this is not only adherent with certain competencies, and also with the certified skills also, it is acknowledged by how it can be taken, and along with this curriculum prescribed in such a way, what are the teaching learning methods we can adopt, how the assessment strategy we can implement in the past 5 years of our CBME curriculum. And it is more of, initially we can think traditional curriculum, oh, in biochemistry mostly it's a pathways. So whenever we ask our seniors, our teachers, they will tell about more focus on this the pathways of this our metabolism and all. Now after the CBME, it is make more meaningful in a such a way, more of clinical aspects. For example, in if you take this cholesterol metabolism, I think this is the biggest tough to teach a cholesterol metabolism. Everyone will be agree with this. So why they are reading a cholesterol metabolism? It is more often clinical aspects of what drug can be inhibit this synthesis. What are the statins? How it can be applicable, and now, so these are the clinical relevant concepts is very well established from this competency-based medical education. So not only that, this experience of integration. So previously, mostly we won't talk about our faculties of anatomy, physiology, even just general medicine, other people. But nowadays, we are more interact with them. What kind of linker cases we can use, how the learners can be more interact with these linker cases. So that is a concept is derived from this recent curriculum. That's a one main point. The second innovations of this our CBME curriculum is early clinical exposure and the electives, and the very important point of it, the formative assessment. So even if you take in one simple topic, we will give some Google forms with an MCQs. So we can assess now on that itself our learners how much they can understand our topics. Even we can put on some clinical videos also and the animations. So such a lovely interaction and AI based teaching learning methods it is adopted by our faculties, and this is not only with this AI incorporation, and also assessment strategies also modified. It's a formative assessment and OSP and OSCE techniques and all we have implemented in this latest curriculum. And the main focus of an competence-based medical education, we have defined the roles of an physician, but not only clinicians. We have made it as a communicator, critical thinker, and researcher. So I used to tell my student all the classes, this formula is very important. We are biochemist, even though we should be understand the C3, L2, PR, researcher, professional, and each and every topic we have to tell about. I am a researcher in this area. I am this communicator. For example, you are telling we are teaching us on lipid profile and cholesterol metabolism. So where it is used? It is used in a, it is used in a, to diagnosis and dyslipidemias. So you are going to be not only clinician, you are going to be a communicator. And how the pathway is linked with this hyper levels of an our profiles, that is clinically more relevant with this CBME curriculum. I feel we have to be long way to go whether it's a succeed or not to say.
Okay, ma'am, you have very nicely put up the concept before and after the CBME. And now I'll come back to Dr. Manju, madam. Madam, why do you think students often perceive this biochemistry as very difficult or clinically less relevant topic, especially in the first year?
Okay, very interesting question. Though we belong to biochemistry, we know if anybody asks, they'll tell that it's very difficult subject, very difficult. Even my previous dean of my institute, when she sees me, she'll tell that, Madam, how did you do MD in this subject? So let's think of when I thought why this question, why do we perceive it as difficult and why do students perceive it is very less clinically relevant? I think I'll deal it with under three aspects. Uh, One is the inherent character of our subject, of the discipline called biochemistry. Second is the teaching learning methods that faculties have used to teach biochemistry. Third is the students' perception and the new gen students, how they are perceiving. So the first thing when I come to the inherent character or the characteristic of this discipline called biochemistry, we all know it's a very abstract subject or a discipline. Abstract. The concepts are very, very abstract. They're very complex. And we are going to deal with every content, we are going to deal with the molecular nature. That means we go to the receptor level, the subdivision of the receptor level. So it is very complex, abstract, and molecular in nature, the subject itself. And whenever we are dealing with any pathway, the enzymes, glycolysis, heme synthesis, so it deals with a sequence of reactions. They have to by heart lot of pathways, lot of enzymes. So a lot of chemical jargons we use. Then these and all, and when a new after 12th, when a student enters first MBBS, he cannot see them, he cannot visualize like what happens in anatomy. Whatever he's taught in anatomy, he sees in the dissection hall. Physiology, though not as much as anatomy, many of the practicals they reflect what they are teaching. But for us, for making a mental image of what we teach itself, it's very of the molecular processes. Student finds it difficult, and there is a very heavy memory load for what we are. If they don't understand the concept or the conceptual anchoring is not there, they don't understand why we are learning all these things. So it's a heavy memory load. And and all these things are very, very intimidating for students. So, and when we teach them as isolated facts, go to the class, teach only, we are not telling why we are teaching it, why we are teaching heme degradation, why are we teaching glycogen metabolism, nothing like why or what clinically relevance. We just go and just bombard them with a cycle, enzymes. Finally, 5 minutes or maximum or some 10 minutes we spend for in the end, towards the end of that 1 hour session, we speak about the disorders associated. That's what even today we are doing. Actually, that is one reason, I suppose, if we start a class with why this pathway matters, why are I teaching you for a first MBBS student who's going to become a clinician, this pathway or this detail, this concept, it won't look so difficult, I suppose, I think. Now coming to the second part of students' perception. They perceive the subject, it lacks clinical relevance, or they think that it is having limited early clinical context. They are not. And I'm not telling, now it has changed a lot. Before it used to be, think of the time when we were all learning, we tried to find out the clinical little context and all, but we were taught like in silos, it will be taught. They come and they teach. So without a clinical proper anchoring of that concept or that topic, biochemical concepts are always seem disconnected from real world medical practice. That is one thing. And when you take them to a laboratory or a practicals, biochemistry, think of the old practicals. Now, a lot of differences has come. Lab work, they don't think it is a part of clinics or a clinical work. They think it is a technical thing. They think that some colorimetry they are doing. But instead of that, nowadays what we do is that no practical exam is with estimation or something. We give a clinical, what is it called? Clinical scenario. And then we give a urine sample perform or a plasma sample or a created sample. So most of our marks we give for discussing the clinical things of it. So this is what happens. Now, the third reason is the teaching learning methods that we faculties or have used for teaching biochemistry. That's one major thing. The traditional teaching usually focuses on memorization of cycles, isolated reactions. The questions also, what is the key enzyme? How many steps are there? I don't understand why that has its own importance, but that way, nowadays it has changed. So when the purpose or a clinical application is not highlighted, the subject feels very dry and overloaded. There is no earlier times there was no integration with other subjects. Thanks to CBME, now all our three subjects disciplines in first year, they are all aligned. That means at the same time, anatomy takes about pancreas, physiology takes about the insulin action, we take about what are the function tests related to it. So students have little more in. So the lack of all these new methods that we use was the reason the students perceived it to have to be very difficult, and it has nothing to do with clinics, they thought. That's what my.
Thank you for sharing your opinion. So, building on this understanding, now we will move to the linking of this biochemistry into the roles of the Indian medical graduates. Dr. Sangeetha madam already mentioned few of the roles of the Indian medical graduates, and we all know the 7 major roles of our Indian medical graduate. My question to Neelam madam is, how does biochemistry contribute to the core roles of these IMGs?
Yeah, thank you, ma'am. Thank you, Vijetha, ma'am. Nice question. Uh, how biochemistry strengthens the research orientation? How biochemistry contributes to the core roles of the Indian medical graduate? I think so. Biochemistry does not contribute. Biochemistry is the foundation of all these core roles of the Indian medical graduate. I was going through this extract from the Graduate Medical Education Regulations 2017, where they have wonderfully described the functions in the following roles the IMG should go as an appropriately and effectively. The number one, the number one, the number one role is of the clinician, where it says the clinician is the one who understands and provides preventive, promotive, curative, palliative, and holistic care with compassion. Now, when a Indian medical graduate, he understands basic knowledge of all the metabolisms. For example, I have a basic understanding of a glucose metabolism. So whatever is taught, whatever is a 360-degree view that helps in understanding the insulin resistance, maybe about the diabetic ketoacidosis, hypoglycemia, interpretation of the fasting glucose, what is OGTT, what is HbA1c, etc., etc. So, biochemistry provides a complete basis or a mechanistic basis of the diseases. So, this enables the clinicians to correlate whatever symptoms in the patient with the metabolic abnormalities. So yes, IMG should have a very sound understanding of the biochemical pathways, and it will help the clinician in the total run for accurate diagnosis, for rational investigations, and as well as the appropriate management. The next role that has been given is of the leader and member of the healthcare team and system with capabilities to collect, to analyze, synthesize, and communicate the health data appropriately. Now, whenever a clinician with a sound understanding of biochemistry, he understands what are the test principles, what are the tests that has to be applied, so he can remove or avoid any unnecessary investigations. Knowledge of all the pre-analytical errors, the analytical errors, the post-analytical variables, so that will help him coordinate with the lab personnel or the lab technicians. So biochemistry itself makes the IMG stronger to act as a responsible healthcare leader, and it promotes in a clinician what is rational test utilization, cost effective diagnostics, teamwork with all the laboratory personals, with all the other clinicians. So as a leader he is more equipped. The next role that has been defined is of a communicator. Now, communicator with whom? So they are saying communicator with patients, with families, with colleagues, and with community overall. Now, if a sound understanding biochemistry enables or tells that physician, yes, if this is the test that is needed. If this is the test that is needed, then what are the abnormal values? Along with that, if he needs to communicate with the families, with the colleagues, with the community, so any other lifestyle changes that are required, any why is there adherence to the treatment that is required? Now, for example, in a very layman term, when we tell a patient or when an Indian medical graduate tells a patient that yes, your blood sugar is very high, right? So that means you need to exercise. So exercise will help your muscles use that glucose better. So this is in a very layman term. So if the IMG understands all the basic metabolic pathways, the biochemical pathways, so it helps, it improves the understanding, it improves the patient trust, the compliance, as well as the decision making in the IMG. One more that has been given is of the lifelong learner. Nowadays, biochemistry or modern medicine is not limited to any one, core. This thing, it is increasingly it relies on genomics, proteomics, metabolomics, and very importantly, the personalized as well as precision medicine. Now, if you understand the core biochemical principles, so it allows the physician or the Indian medical graduate to continuously update the knowledge. So, biochemistry basically it cultivates your analytical thinking, overall thinking, and prepares for any advances in the medical sciences in present or maybe in the future. One more point that has been come up is about the professional who is committed to excellence, who is ethical, responsive, and accountable to patients, community, and the profession overall. So maybe initially in the first one or phase one MBBS itself, the knowledge of the laboratory ethics that we tell them in the safe laboratory practices, or so they this prevents the misuse of the investigations. So they understand what is quality control, what is quality assurance. So maybe in the future, as IMGs, they ensure informed consent before any specialized test. So any manipulation, any selective reporting of the lab values are curtained down. So the professionalism in medicine, so that comes up in an IMG. So ethical conduct, responsible reporting, etc. Uh, is there. Importantly, one more that has been come up is about the critical thinking and researching. So interpreting why a particular biomarker varies among different individuals, one particular metabolome or an maybe any one particular amino acid or something alters in a particular disorders. So all this knowledge of biochemistry trains the students to think very logically, analyze your pathways, and interpret data, and this may help or this is very essential for research, and furthermore in the evidence-based medicine. So overall, I think biochemistry is not a support. Biochemistry is a framework on which our core roles of the Indian medical graduate it rests on.
Ma'am, thank you so much. You have put everything you have put everything together, all the roles together, and you have very beautifully you have explained from the base till the advanced level of all the roles. Thank you so much for that. Now, my question to Dr. Onjal, sir. Sir, one of the main role of IMG is being a researcher. So, and now all the universities are behind this, especially for undergraduate research, because that gives them more weightage for their ranking purposes. So, can you please tell us how biochemistry can strengthen the research orientation in our IMGs?
Thanks, Dr. Vijetha. Thanks for asking this particular question. Is it audible to all?
Yes, sir.
Yes, sir.
My internet is little unstable today. The weather is not good
No
at
issue,
Jammu.
sir.
Anyway, so this is a very relevant question to me. Miss, I have taken this subject, biochemistry, post-graduation with lots of enthusiasm and hope. I thought this is the subject where research can excel. We can excel in the field of research. But over the period of, say, around 19 years, when I opted in 2006, I still do not consider myself as a good researcher. I have struggled a lot. Most important thing is that the research field is not delineated clearly in our subject. It is very haphazard. The scope of subject is huge, so we are not able to focus on one point agenda. We do not get proper mentorship. So these are the limitations, but over the time from our failures we learn. So we think that our students should not face all these issues. So most importantly, we have to develop an attitude of research from undergraduate students. So whenever we start research, we always start with some problem statement, or we have to find a problem. It may be relevant to clinical thing or basic science thing. Then from that, we have to develop hypothesis. Then we develop objectives, and to answer these objectives, to get the solution, we use some methodology, a standard methodology. From that, we will get some data which we need to analyze, and finally we have to take conclusion. So it is a very complex process. So we have to teach the students in a very simplified way. Their role as a researcher may be limited initially, but we have to always motivate them to think out of box, because once they get interest into the research, then only they will take it as a challenge, or they will have interest or curiosity in learning biochemistry. So this is helping both the things. This will help them learn biochemistry, and automatically once they learn biochemistry, they can apply the research, that is basic science research, which can help in clinical outcome. So my point here is to convey that we have to develop a research attitude from the first year students. For that, we can ask them to take small research projects. Mainly now we know that there are STS projects where they get a handsome amount of money also. But apart from that, even if they do not get, all students cannot get. So we have to motivate them to take at least the observational studies, descriptive studies like knowledge, attitude, practice based studies, because we have in our background a laboratory, which is the serving clinical lab. From that, we have ample amount of data. They do not need to go for high level of studies, but at least basic studies they can do, which will strengthen their research skills, and in future they can go for full-term research job, because biochemistry is known for the teaching. Research comes back in background, so we have to take research in a front in the at the front stage, I want to say. And additionally, we have got latest technologies in our field. So if they can utilize these technologies, this can be the best research tool. So for Indian medical graduate, critical thinking and research attitudes are critical, important, the most important. So critical thinking and research go hand in hand. And biochemistry always has a key role in research.
Yes, sir, you have rightly pointed out all the important things to handhold our undergraduate students to become a researcher. Now, my next question to Dr. Manju madam as well as to Dr. Sangeetha ma'am. One of the role of Indian medical graduate is a professional, and the professional is the one who is committed to excellence and he is ethical, responsive, and accountable to the patient, to his profession and the community. So, whether this biochemistry can play a role in shaping their ethical and professional behavior under ADCOM.
Okay. There's no doubt whether biochemistry can play a role or not. It's not only biochemistry, any discipline. A doctor, a mentor, a teacher has a major role in developing the ethical and professional behavior in his or her students. So let's start with that ADCOM thing. CBME has already brought an ADCOM, a very elaborative module where module 1.1 has been given for biochemistry, where it deals with two things. One is professional qualities of a doctor with lifelong learning. And second one is the role of a physician in healthcare system, society, and community. So I'm not going to those details because that's for the last 6 years, we are all very good in various teaching learning methods we're using to convey these messages to the students. I would like to emphasize here, not on those two aspects told under ADCOM module, what else can we do related to biochemistry? So before jumping into biochemistry, it actually, if you ask me as a teacher, it can start from making the students come to class on time, making the students understand the significance of sticking on to deadlines like timely submission of records, maintaining a proper decorum in an examination hall, or maintaining an academic integrity by avoiding plagiarisms, then respecting intellectual property. All these are generalizedly. These things can be, we need to see that students imbibe all these things. And coming to in detail about what biochemistry can offer other than those two by ADCOM, almost everything has been covered by Madam and Neelam ma'am. But still, I would like to bring ethical conduct in laboratory practice. We should not think every time the patient himself or herself is required, the student has to meet the patient in person to teach them, to learn something called professionalism or ethical behavior. No need. In biochemistry, teach the student the importance of accuracy in reporting a result. Avoid fabrication, no falsification of reports because some problem occurred in the lab, never. Any selective reporting. Then to tell them that a biological sample, how to handle it properly. How to respect human biological sample. That's the most important thing. One sample has to be considered like one patient. One patient's clinical decision is being decided by that one sample. So we need to tell the importance of quality assurance while we are reporting. The significance of adhering to the biosafety, what is it called, the principles, so that they become responsible towards patient safety, personal safety, all these things. While interpreting the reports also, lab reports, confidentiality of maintaining the patient, because we know that patient's data, the confidentiality of patient data, over interpretation or under interpretation to be avoided. Then what is the ethical responsibility of us to give an accurate reporting? Then you need to tell about that again and again. You need to tell the students that one sample is a real patient, a clinical decision, possible consequences that can occur if an error is made. So all these we can do. Other than that, through teamwork, professionalism can be taught by a group seminar in the classrooms, or a small group teaching, or collaboratively handling one equipment. All these things can be tried. All these will go definitely in though not directly, indirectly, by due course of time, they tend to become very professional. These things adds as small pieces. And in our college, another issue that we have is there's a students forum where we students are asked to make a 5-line card based on any public health relevant topic from all departments. So from biochemistry, we ask the students to make these cards, 5-line cards related to malnutrition or vitamin deficiencies, diabetes, or any lifestyle disorder, or any all these things. So while they're preparing itself, that makes them highlight the ethical duties they have towards preventive counseling, etc. Not only before reaching community medicine itself, we can also, biochemistry can also try doing all these things. So all these are some methods which we can do related to biochemistry, which will integrate biochemistry with professionalism. Social accountability will come in the student, and it will also strengthen the early professional identity formation in the first MBBS level itself. This is what I need. I have to tell about the development of ethics and professionalism in our young MBBS students.
Sangeetha ma'am, you want to add anything?
Yes, ma'am. So the accountability to the patient and the community and the regarding the professional ethics, I have divided into three aspects, ma'am. One is related to the patients. Already, Manju ma'am excellently tell about this lab and how ethically and professionally we can deal with the first MBBS biochemistry. And I want to add on more one point in it. This cost effective and turnaround time, how long it will take for each sampling, and that point I want to insist on and add on to this, ma'am points. And the second thing is I want to accountability to the community. Here I want to share this behaviorism theory. So the behaviorism theory, when the learners enter into the first year MBBS, he supposed to think about I am a clinician, I am a physician. So that thinking process, when he feel I am a doctor, so that feel supposed to be we make the first day itself. So actually NMC is allotted for I think at com it is an only few hours, but each and every classes we have to tell about the professionalism and ethical aspects, all those things. And the community accountability, I want to emphasize on this cost effective of the test is what is the cost for this corporate setup, what the private hospital will have, how much of the cost per test, and this what the administrative framework it is happening in the tertiary care setup and the primary care setup and tertiary care setup, availability of the lab test. So that will makes the first MBBS student itself a good professional. So we have to make them to explore all those the first level, first and second tertiary care setup of an not only laboratory investigations, and through this early clinic exposure we can share their views also through the self-directed learning or a panel discussion, some sort of a debate we can do. And one more thing, ma'am also insisted on this, the falsification also. So the medical legal litigations also we can share with. For example, biomedical waste, if it is any mishappen happen, it is a punishable. It is an payable at up to 1 lakh, I think so, according to this BMW guidelines. And also punishment for an imprisonment maximum 3 months. So these are the concepts we have to be these professional aspects we have to be incorporate in day-to-day practices. And along with this diet counseling, how can be communicated with the patients, and the lab value and interpretations. So these are the framework we have to be shared with our student through this and either self-directed or the early clinical exposure. And the individual framework aspects I want to share with this career pathway. So now we all know this nanotechnology, AI based technology is moving very fast. So we not to tell only this good aspects of, we have to tell about the learners the ethical aspect of the usage of the AI, nanotechnology, how it can be falsified, it can be happen. That angle also we have to be insist to our learners. And the innovations of the telemedicines, how the professional happen through this telemedicines also, it's a futurist aspects we can tell through those our student by day-to-day practices. So this is a thing about the professionalism and accountability to the patient and the community, ma'am. And this is, we can call it as a cultural competency. What is happening your LMS and HMS and all, we can share with our learners. Thank you.
Thank you so much for bringing the point from the diagnostic laboratory, especially highlighting on the impartiality and confidentiality of patient reporting. And also Sangeetha ma'am for bringing the ethics of AI, because nowadays everybody uses AI for teaching, learning, as well as reporting also. So the ethics in AI is also very, very important topic. So now all the panelists, they have mainly highlighted how biochemistry meaningfully contributes to the diverse role of our IMGs, from research to professionalism to the ethics. Now, with this strong foundation, let's move to the next topic, that is core concepts and the clinical integration, focusing how biochemistry principles translate directly into the clinical understanding and patient care. So, my question to Dr. Neelam, madam, which core biochemistry concept do you feel are the most crucial for clinical practice, and how can we emphasize them without overloading the students?
Yeah, very nice question, Vijetha ma'am. In the vast curriculum of biochemistry, when I was going through, I zeroed down. Of course, there are many of them. I've zeroed down on two of the biochemical concepts. Number one is a very important concept, which is the integration of metabolism. We teach metabolisms, carbohydrate, lipid, protein, but somewhere this core clinical concept takes a backseat. So the metabolic adaptations, maybe in the fed state, maybe in the what you say, in the starvation, during prolonged starvation, the effect on various organs, like the effect on the brain, skeletal muscles, liver, cardio muscles, etc., is a linker metabolism that should be done in great detail. The second biochemical concept that I have zeroed down is on the acid-base disturbances. These are very important core concepts, which are not only important for the phase 1 MBBS students, but over their whole journey of an IMG, the chemical pathology of the acid-base disturbances, specifically the anion gaps, the high anion gap metabolic acidosis, the normal anion gap metabolic acidosis. And because we have a very limited time, maybe we get effectively 8 to 9 months of teaching for phase 1 in biochemistry. So maybe a separate lecture or something uh, is not necessary, whatever we are teaching in, whatever we are taking in. So maybe the last 15-20 minutes we can focus on these. We can just show any clinical triggers, any case vignettes, any lab reports. For example, if I have a case of metabolic acidosis, so focusing on what is happening, why it is happening. Yeah. And then at the end, you can ask, or you can revisit this concept. This is known as spiral learning. Whatever they have learned earlier, at the end, just as we summarize, we can go, or we can go with the increasing clinical depth. What is this? So this is not overloading of the students. Students already have a base knowledge of, if I'm taking the example of acid-base disturbances, they already have a basic knowledge. So at the end of the lecture series, a 15-20 minutes that can be separated out from the complete whole lecture series will go a long way for the students. It will help them to reinforce what is been already taught.
Thank you, madam. Thank you for beautifully explaining the linking of these biochemical pathways and the mechanism into the diseases. My question to Sangeetha, madam. Madam, can you please share some more examples?
Yes, ma'am. Sure, ma'am. So I have a list of 78. Sure, with the time permit, I will tell you, ma'am. So each and every classes, we supposed to be think end of my class, what the learners going to be acquire this knowledge, where he is going to be applied, where he is going to be analyzed in the patient care. For example, the first class itself, we will take about an ORS, for example, a transport mechanism. And this, so in this, in the concept, we used to take an ORS packet. We will show to everyone. So what is how the ORS important for a transport mechanism itself. So the second topic we can see it is an the chemistry of carbohydrate. The chemistry of carbohydrate, D-glucose, we can call it as an dextrose. So our CRMA in my class, the last 10 minutes, as Neelam ma'am said, the last 10 minutes, my CRMA will come and explain us who are posted in this casualty. The CRMA who are posted in the casualty, he or she will come and explain about what is the use of the 10% of 25% of the dextrose, where it can be used in emergency situations. So all the learners we will see this the bottle, how the 25% of the dextrose, how it is present, and 10% of the dextrose, how it is present, where not used. So routine monitors as an we 4 or 5 faculty usually take the classes. Apart from anyone from this outside, definitely they will see some curiosity. That curiosity we can create as soon as possible, and how much it is possible we can incorporate. At the same thing also, there's a glycosamine and glycon, the heparin vials we used to show them. And this is the most interesting thing we have done in our classes. We have I asked you to draw a regulation of blood glucose for their own. For example, the morning they have taken 8 a.m. or 8:30 a.m. they have taken a breakfast. I asked them to draw your blood glucose when it is increased. After 2 hours it is increased. By this before lunch, what it has happened? What happened? The peak. So these kind of an experiential learning and thing we have developed. And one more, the inborn error metabolism, we have used to take in concept mapping, and AI generated pictures also. They have to explain not only generation, how, why it has happened. I mean, this picture, why it is happening. So they have to explain in the clinical scenarios also. So this is a team-based learning also we have adopted. And the mechanism of enzyme action, we have used clay models. Like when we give our children for an clay and all, no, so we ask them to bring in some clays, and the substrate in one color, and the product in the one color, the inhibitors in the different colors. So these are the newer innovations we have to develop the learner better understanding our biochemistry. And also we have developed a problem based learning for an abnormal urine constituents with a lot of clinical triggers. So this is a thing we have done in our sector, madam, to better understanding our biochemistry.
Ma'am, I am sure that because you have incorporated so many things like clay and you have called the clinical person, you have shown them the ORS and the bottles. I think the students are actively involved in these sessions than just showing us our PPTs or a blackboard teaching or just telling them orally like this is what is happening, this is how the ORS works. I think even this is a very good point, and I will also try to implement all these things in my future classes, ma'am. Thank you for this suggestion. Now, I will request Dr. Onjal, sir. Sir, can you please tell us like how the ECEs, the early clinical exposure, is meaningfully incorporated into biochemistry teaching?
Again, thanks for the question. This is very relevant. Again, I can go back and see my post-graduation journey. During that time, we had to go for allied departments posting in the Department of Pathology, Microbiology, and Medicine. So when I visited Miss Patho and Micro, we are well oriented. But when I visited the clinics, when I went to the wards, I was very what we say motivated, because the postgraduate students, the junior residents, senior residents, and the faculty, they were managing the patient, and majority of their work was dependent on the reports from biochem, patho, and micro. Obviously, the biochemistry reports contributes to 50 to 60% of the finding. So I was very thrilled. This is the first point. So we should expose our students to this real clinical picture, but it may be difficult to take 100 or 150 batch students to clinics every day. So we have to take them in batches along with our PG students or some supporting staff. This can be done. Second thing is that we have a trinity of what we say a responsibility. First is the teaching biochemistry, second is research, and third is the lab services. But lab services will be incomplete if we do not expose them to the outcome. So whatever the laboratory results, what's their outcome, how it is helping in the diagnosis of disease, how it is uh, modifying the treatment, how it is helping the management of the disease. This is critical. So over the period, they will generate interest in this correlation. But again, this may not be feasible for all the UG students. So, what I have done during my past 10 years teaching, I can say that I motivate students to go back home, take their parents' permission, obviously, and see their reports. If they give permission, they can check their basic results like starting with CBC, glucose, lipid profiles, LFT, KFTs. So in every family there will be some lifestyle disorder, so they can learn from these reports. They can get some insights, means what are the reference ranges, how the complete picture looks like. If something goes wrong, how they have to follow up with the doctor and means obviously manage the disease. So this is one of the aspects. Second is if we want to teach them some tough topics like inborn errors of metabolism, mental retardation related conditions, we can ask them to visit some uh, special schools where these differently abled kids are kept or monitored. But again, that may be difficult. So we can just show some pictures related to this that may help. So overall, the clinical exposure in first MBBS may be little difficult, but we can find some easy solutions for them, like doing own investigation, because they are also asked to do medical fitness. Suppose they have some illness, then how their journey follows. They have the record of their own lab investigations. So overall, this will complete the clinical picture.
Thank you, sir. Whenever I heard this term early clinical exposure, I thought it can be learned only in the clinics or the wards. But you gave us a different perspective that it can be done like seeing the reports of their relatives or the family members, as well as going to other places other than the hospital. Thank you so much for that. Sangeetha, madam, do you want to add anything, ma'am? Do you want to share your experience?
Yes, ma'am, sir. Very nicely elaborated this holistic approach of early clinical exposure is meaningful in the biochemistry. And this is a component of the clinical clerkships also. So, sir, already said, sir, we can serially monitor this lab values also. I want to add on this one point. So, during this early clinical exposure, so they will see this more authenticated. So, the more authenticated real world situations, when we tell about this, it's an nephritis syndrome like this, hypothyroidism like this. When they observe this nephritis syndrome or a hypothyroidism patients in a wards, so it is a more authentic situation. They can, without any imaginary, they can see how the patient's face look like, either they are a sad mood or angry mood, how they will be. So that real imaginary and the real thing we can show them, and along with this they can incorporate the physiology and anatomies also, anatomy aspects of a thyroid also. They can learners can easily understand. So the application of the knowledge is better. The one point, and one more point I want to add on it. When we expose our learners to this phototherapy in the newborn ward, usually the newborn ward, no, I mean not allowed so many people. So our learners, only 5 of them can enter one by one for every day. So that make the how the system it working in our tertiary care setup. So that is a early clinical exposure. So not only the relevance of the clinical thing context, not only this application, and also they can understand the cultural competencies also, and they can see the ward etiquettes, how the ward will be look like, and how I supposed to behave in the ward. So the ward etiquettes, the first day itself they can learn, and it's a more motivation and team building also we can develop it. So was acknowledged by Creres et al from Ludhiana. They have this anatomy department, they have beautifully qualitatively, these are themes they have developed in it. Same thing, the communication skills also better in early clinical exposure during this hospital setting and community level of early clinical exposure also. It does tell about the Manipur study, tell about the good communication skills is developed during early clinical exposure. So our biochemistry is shaping in such a way.
Ma'am, from your talk, one of the main key point what I learned was when they are exposed to the early clinical exposure, they try to understand patient's emotions, and that is very, very important when they go next for treating the patient. So now I request Dr. Manju madam and Neelam madam, you can please share your EC, how you conduct EC in your institute, and what are the best practices that you have observed during this conduct of EC?
Okay, thank you for the question, to Vijetha. Our college EC we are conducting on all Wednesdays. Those months, whenever the 4 Wednesdays are do not have any leave or anything. 4 Wednesdays we get in a month. That means you'll receive from 10:15 to 1:15, 3 hour session. How we do is that initially topics for the whole how many ever hospital visit TCs are there or community visit or central lab visits. Our ECs will be like that. So we will decide the topics before and the theoretical part of that, if jaundice we want to send or MI. So theoretical part will be taken just before the EC visit itself, that portion will be completed. After that, we divide them because it's 4 Wednesdays. We have 150 students, 37, 38, 37, 38. They come. So they come to the department or initial 20, 15 minutes is a briefing about. And once they come, we will give a document called as observation guide. For every case scenario that we are sending, we have something called observation guide. It's a document which says, it's for the students, which says very clearly when you go to the clinics, what are you supposed to observe? And that's why it's called observation. The students think that early clinical exposure, we are going to feel the patient, touch the patient. If clinicians agree, that's a different thing. But we have to give them a clear idea. This is the starting. So they will be giving an observation guide, which writes very detailedly what they are supposed to look today's patient. If it's a jaundice case, what are they supposed to sit and observe? A doctor taking a history or a doctor examining, whatever it is. So it depends. So the objectives for their EC visit will be very clearly written in the observation guide, and the student has to read it. I brief it, and they'll be taken to the clinic. Before itself, we'll ask that department if it is medicine or anesthesia. So that department people will allot a faculty for that. So that faculty will be with the help of a patient in the OPD or in the ward, because it's 37 students. Usually, it's very difficult to take in the ward. So what they do is the patient, if he's adult, he'll be shifted to a room and a demo room, and there they'll be shown, or they'll be seeing the patient, and discussion will happen little later sometimes. And after that, they'll be discussing, and they'll come back, and we'll have a post briefing session, following which we will, and I'll ask them to, if it is a case, they have to take the pictures of all the investigation reports, the history and all, they'll be telling all the investigation reports and all. One student will take a picture and come. We come back and again discuss with the reports about that case, and we finish by a reflection. Logbook is there. In the logbook, they write as what happened, so what did they learn, and how is they going to apply. So this is how our ECs are conducted for past 5 to 6 years. So one thing I would tell is our highlights is, one is we giving the making the observation guide and giving for the students is really useful. This is the feedback that we got. Second thing, students are extremely happy going for ECs. There's no doubt. And they are telling that those topics, usually we send for ischemic heart disease, jaundice, thyroid disorders, or an acid-base balance, all those things. So they are telling that once they go and see, it's very, very easy for them to remember something. Even if we don't study, we can write for the exam, and that remains in their memory also. So these are the things that are the plus points. But one challenge that I would like to tell is that these clinicians who are involved with us, they have to be, it might be, usually they'll be giving a senior resident, sometimes an AP, sometimes even a senior third year PG will also be allotted for the clinical part. So what we need to do is that whoever it is, get the phone number. Now we follow that because we had problems. So we speak to that particular person in person over the phone, that these are the objectives. This is what we want you to expose the students to. Otherwise, he will go to PG level and take class. It was a failure, few of our sessions. Nothing they learned and came back. So telling, exactly discussing with the clinician or the other counterpart other than biochemistry person who is involved into EC is very, very important if you want to make an EC successful. This is that was a challenge that we faced in the last 5 to 6 years. And now this is how we are overcoming that challenge in EC too. That's all from my side.
Neelam ma'am.
Very elaborately discussed, Manju madam. I mean, I must really appreciate what you're doing at your institute. Yeah, in our institute, we try to stick to what is the GMER 2019 that is being given. They said that the ECE for the first year is around 90 hours and 30 hours for each subject. So that includes basic science correlations of 18 hours and 12 hours of the clinical skills. Though we try to stick to this, somewhere we cannot in a complete nutshell. So what we do is some of the ECE we take it as a basic science correlation, maybe in the classroom setting, and some of them as a clinical skills, maybe in the ward settings. So many of the times we have faculty from super specialty departments, like from Department of Endocrinology will take an ECE on diabetes mellitus. We have faculty from the Department of Hematology that will cover all the hematological disorders like sickle cell anemia, thalassemia, etc. So how is this conducted is number one, either as a case triggered classroom setting or a classroom ECE. So simple real life clinical trigger like a patient with fatigue and pallor, a child with protein energy malnutrition, and the students then can be shown a short clinical case or sometimes a picture or this thing, a chart, and the students can be asked, okay, what is the biochemical parameter that you feel this is abnormal? Why this abnormality? What is the pathway involved? And sometimes it is a lab linked ECE. Like Onjal sir said, the lab investigation reports, so correlations of the blood glucose level with diabetes, serum bilirubin with jaundice, and yes, as Manju madam said, observation based early clinical exposure, like observations in the ward, etc. So this is how we cover this in our institute.
Ma'am, thank you for sharing. Till now, we discussed different components of CBME. They have introduced ECEs, ADCOMs, and many more things. So, to achieve all these things, we should have strong teaching, learning, innovations too. So, I want to ask all the panelists what are the active learning strategies that you have found effective in making this biochemistry clinically meaningful? We can start with the Sangeetha ma'am.
Ma'am, this is a very nice question, but very tough task to engage 100 students, 150 students, and 200 to 50 students in our classes. So mostly, whenever our preclinical phases, it is usually on lecture based or small group teaching in this afternoon sessions and during our practicals. So the morning, either 2 to 3 theory classes, we have to engage in such a way. That is also we have to make a more meaningful, which is relevant within clinical applications. So what we can do, the flipped approaches. So nowadays the learner don't want to give a lectures. They don't want to any lectures. It is available freely available in this or so many of online aspects. So what we have did is we have applied the concepts of universal design for learning. So this is nothing but it's a flipped approach of we have to select one topic. We have to ask them read for this topic, and after this flipped up, I mean it's like a flipped approach. So we have given a topic to the learners. They can choose the presentation of the topic. It can be concept mapping, or it can be an any case based vignette, or it can be an MCQ. So all the students will learn about this. We have done for fat acid synthesis. We all know it is an one single unit related to this. There is a one pathway and the regulations only. So I have made it in a such a way. So few students they have developed an MCQ. Few students they have developed a concept mapping, and during this after this, when they have read in this home or in a class, I mean in this it is a blended approach. So when they come to this our lecture, each one of you, for example, 10 MCQ. So the 10 MCQ within what 10 to 20 minutes we have covered, and the concept mapping any one of this lot based they have presented. Then this another clinical weakness, they easily reason out this concepts. So the everyone was engaged. Everyone was engaged. So this is a type of an thing we can do on our lecture based classes. So the remaining again seminar and seminar presentation symposium we can do our thing. So this is the newer concepts we have developed in our biochemistry department. Yes, ma'am.
Thank you, ma'am. Onjal, sir?
Dr. Sangeetha has nicely elaborated that flipped classroom is one of the best way. Here the student takes the charge. He will do the learning. We have to obviously be the guide on the side. This is one approach. Second is a small group discussion. Obviously, we have to divide the batch into small groups and we have to give them the topic prior and they will discuss it among themselves. But what is the better method than this is the jigsaw puzzle method. Means I have learned it recently, 1 or 2 years back, and this is really very interesting. Everybody likes to play. So jigsaw puzzle we can solve by completing the picture. There are fragments. So we can divide the batch of suppose there are a student batch of 100. We cannot divide them into big groups. At least 5 to 10 students in each group, and then we can divide a topic like clinical presentation, biochemical basis, lab investigation, disease presentation, signs, symptoms, outcome, treatment, something like that. And each group will learn that particular topic. And next day, they will teach this point to another group. So there will be some expert group and other groups. So expert group will teach their own topic. Suppose lab investigation, that will be taught to other people and will be the guide on the side. So this method, students really like, but obviously we have to mix them. Means we have to use other methods also. Apart from that, uh, gamification, this is one of the important aspect. Miss, even I have not used it, but I have attended one or two miss, this was just like quiz. There are many what we say online platforms like Kahoot, quiz, and many more, where this is very interactive. They will calculate your score, timing. So this is just like getting the answers in the form of MCQs or short answer question. So they can compare it with the peers, and we can obviously give students some token of gift who wins this quiz or a discussion.
Neelam, ma'am, can you please add some more active learning strategies?
I mean, yes, phase one is all mixed method, all the teaching learning methods, what suits us and what suits the students. Yeah, so many of the concepts have been very rightly put forth, the case-based learning, the problem solving, the flipped classrooms, the small group discussions, the jigsaw methods, the gamification that has been put up. Something other than that, I just would to add is, which is very practical. Number one is a concept of a muddy point. Maybe at the end of the lecture, we can just ask the students what one concept is that you understood the most, and what one concept is the one that you did not understand. So maybe one or two students, so over students, maybe we have 150, 200 students, we get a gist of what is being properly conveyed to the students and where the students lack the knowledge of. One more thing that I personally do is because our curriculum is very vast and we have very small time in teaching, there is one this thing that we do in internal assessments, like we give them home assignments. Right, in home assignments, what NMC says, it is a 15 marks this thing, and it is a prerogative how you spread out those 15 marks. So maybe 4 to 5 marks can be asked, or the questions cannot be very rote questions, write a long question or a short note on. Questions can be very innovative, like generally write an autobiography of insulin as if it will be a living entity. So the students can be asked about, the students can write I as an insulin. So the origin, the synthesis, the normal physiological role, the regulation, what happens when function is disturbed, etc. The diagnostic marker, it is a very this thing. So that can be written as a first person narrative, a very simple language, but the students needs to get back and read everything about gluconeogenesis, glycogenolysis, etc. So these innovative questions can be introduced. And yes, other mix and match methods are there, which are already covered.
Thank you, ma'am. Manju, ma'am.
Yeah, actually, I think all the methods, most of the active learning strategies have been covered, because if we attend one MEU class or an MEU workshop, we are familiar with a lot of things. But for me, what I think, like for example, debates we can conduct on topic, that's not feasible for every topic. Once in a while, we can try all these things. Debates on a topic by dividing the whole batch into two, or groups keeping on adding points. Then all those things can be done. But I would like to share the most important thing, which I always feel from my experience, is the feasibility. The various methods, but how feasible are these methods with the available infrastructure, number of students, and the faculty that we have? So I would like to highlight on two things: one on theory class and one in a practical class. One method, theory class, what this I have been following for the last 2 years. So I can just tell. One is only asking after the class, give them like what madam has told, Neelam ma'am has told, assignment as an assignment, but I don't give writing too much. I ask them to make a concept map. Concept map making by students. They have to take a chart paper and they have to write, not type or anything, write, and with a sketch pen or with whatever it is. Concept map creation, it's one of I found, and the students have also told, ma'am, that is really helping us to summarize whatever we have learned. And we need to read everything so that we can make a concept map. So based on the student feedback only, I continued this. Most of the sessions, mine will end up with, not every class, but almost 60% of my classes, I ask the students to make concept maps. So they go home, make a concept map, and next day, and few of them have to present also sometimes. So that, like for example, metabolic pathways, they need to put the whole, not the pathway is not what I tell. I'll ask them to put this thing, and what are the diseases that occur due to some problems, vitamins deficiencies, like that. So that why it works is that it helps in integrating and consolidating these complex pathways with diseases, their biochemical basis, and also the management principles. They all understand that. And next thing I would like to tell in practicals is, what I have tried is that whenever we give a sample for estimation, students first they'll ask, when it is a urine sample, ma'am, is it a real urine sample? Is it a real blood sample? So I tell, no, it is made. So what we do nowadays is that only during that first initial 5 minutes, when we brief on the practicals estimation or urine analysis, what we do is we really bring a blood sample, separate the serum, and we then go ahead with doing the estimation in front of them and show the values. And our practical class usually nowadays, even for exam, university exam, our whole university follows this. We give a case scenario, nothing like do estimate, perform the test and identify abnormal, or perform, estimate the concentration is out in from our university. We give a case scenario and then we ask them to do something. And the whole discussion is based on the values that the patient's sample gets. That is another interactive method using real-time patient samples. And I found students find it very, actually that bridges the bench and bedside ideas, and it has worked out very well. These are the two things I wanted to work with my experience. I have worked out well, wanted to share. Thank you.
Thank you so much, ma'am. So there are so many active learning strategies. I think most of us have already implemented some of them. Some new we have learned. I have learned two new learning strategies. One is muddy point autobiography, as well as giving a real samples for the practicals. So I will try to implement these in my future classes. So now this question is open to all the panelists. So what is the role of, what role can biochemistry play in electives under CBME? So please share the electives that your department offers in your institute, and what are the feedback that you have received from the faculty who is taking those electives, as well as the students who have taken up those electives. We will start with Onjal, sir.
Yes. So, talking about the electives, this is new institute, and unfortunately, none of the interns or other students, they have opted for biochemistry lab posting. But again, this is the fact that biochemistry always remain behind the what we say curtains. So we have to take little efforts to motivate UG students so that they will take interest in laboratory medicine. So majority of the part of this laboratory medicine is covered in biochemistry. So once we gave them rounds of the sample collection area and actual 24/7 lab, that will help. But apart from that, uh, molecular diagnostics or genetics is again the upcoming or the future of biochemistry, we can say. So we have to create interest, and for that we need to give them some hands-on training. Right now, what we are doing is the traditional biochemistry, but the fact remains true that the instruments for molecular diagnostics are not available at majority of our institute. So nowadays, some companies like Thermo Fisher or Biorad or Applied Biosciences, they have come up with some interactive videos. So animations and videos, how you will perform suppose a DNA extraction or PCR or some other molecular techniques. You can see these videos, or there can be some interactive sessions. Apart from that, I think lifestyle disorders is another core of biochemistry. So starting with obesity, diabetes, liver disorders, atherosclerosis. So these disorders can be targeted so that they will choose biochemistry for their electives.
Manju ma'am, can you please share your electives?
Yes, we do conduct electives from the Department of Biochemistry, 10 students every session and actually our electives is on the topic quality assurance in a clinical biochemistry lab. So we used to conduct, we had a WhatsApp group will be formed and we put a schedule and they come, the topics like instrumentation, what is quality assurance, then what is internal quality assurance, all the West Guard rules, then hands-on experience of we get the, what is it, the graph printout we show and we ask them to find out the errors, all those things. That was we felt that when we started 5 years back, it is wonderful. But actually, we need to be very open for the feedback from the students. That I learned. We am very, I don't hesitate to tell that we improved our electives just because of the students. First year electives, they told, ma'am, it's so boring. They told me. I said, I didn't get angry. That's a truthful thing. Then I thought, what can be improved? So based on that, they needed something that they can do. In spite of me giving the printouts also, then what we did is we introduced venipuncture into it. So first one day we take them to the skill lab and teach with the trainer how to do a venipuncture. Then by 15 days, at the end of the day, they go to the lab and they started performing venipuncture. Once I introduced venipuncture, you won't believe, kids started opting for taking biochemistry thing. It's not an exaggeration. That's what we saw. Because what they are looking is that why should we hear the theory, whatever it is? We need to learn something. So that was one thing. Second thing, what I did was that instead of taking the printout of the what is that called of the our Levy Jennings chart and all those things from our auto analyzer, they were taken to the laboratory and they will stand there. They will watch, no printout and all. They'll open and they will be seeing. They'll be seeing it and they'll tell that today this is that, like that. When they started doing hands-on, they're very interested. They won't come back to the department. They were staying in the central lab only. The third thing which what we did is that another thing that is also because of the because of the feedback that we obtained from the students only, tracing a patient in the ward. That was the another part of our electives. As part of our electives, we give every one student, 10 students are there. Every student we give the UID number. So they have to find out where this patient is, in which ward. They go there, collect the history and all, come back, collect the reports from the lab only. They won't do anything. They'll collect the reports of the patient and they'll come back to the department, and the same day or the very next day afternoon, we'll have all the 10 students will present it. So they are presenting what they have seen, like exactly like what happens in the clinical subjects. So that also made these students. So when I started getting feedbacks after third year, fourth year, now this is the fifth batch which is going, fifth batch is going to come. So they told that the most highlighted points in the feedback they are telling are these three things: venipuncture, hands-on experience in the central laboratory on the machines, and the third one is this tracing the patient to the ward. So what I would like to tell is that whatever be the elective, it should be students, the new gen students, they are very they are all adult learners. They know what they want. If something they don't want, they are not bothered. We cannot find fault in it. So our role is to get proper feedback from them with an open heart and accept it and try to make it. I revised mine twice, my electives from our department. So these are my experiences that I would like to share here. Thank you.
Thank you, ma'am. Neelam, ma'am.
Yeah, ma'am. Manju, ma'am, very elaborately discussed. Lots of learning from your electives. In our department, what we do is there are various faculties. All the faculties, they have their own individual electives, right? So one of the elective that I conduct is automation in the clinical biochemistry lab. The number of students that are for this electives are total number of 10. What will be the learning objective of this electives will be the students should state the proper principle of automation and enumerate the steps in automation and enumerate and discuss the phases of automation. Now what that does, it means that whenever the students come to the clinical biochemistry lab, they get a hands-on, they get a what you say about the pre-analytical phase. So what is sample collection? How do you identify the sample? How is the sample prepared? The next round for them is the analytical phase where they are tuned on the analysis, the biochemistry analyzers, what are the various biochemistry analyzers we have, etc. And then is something which is the post-analytical phase where the students understand how is the sorting done, what is the clinical correlation done, how was the report dispatch, etc. Now, what do the student do is number one, they work daily with the technician. They observe what is going on, they assist them, and they perform the biochemical test, of course, in a controlled environment. And then they document their worked of cases. I take a presentation from them of the documentation, and number two, they should give a short presentation on the automation. So whatever they have learned over a period, so maybe if it is a 15-day elective, so at the end of the 13th or the 14th day will be their presentation. So I expect a complete documentation of the presentation, and also a short presentation on the automation. The feedback from the students is up till now very good, because what students feel is biochemistry is all about test tubes or doing test on this thing. But going on in the hospital setting, when they understand that biochemistry department as such caters to patient care, we cater to so many lab tests per day. So much of the data, so much of the workup is going on behind the scenes, and they really enjoy. So it is always a win-win situation for us as knowledge givers, and for them as knowledge takers also. They are really happy when they visit a biochemistry lab.
Thank you, ma'am. Sangeetha, ma'am, can you quickly tell us about your
Yes,
electives?
ma'am. Yes, ma'am. With add-on to this, Manju ma'am, same pre-analytical phases, we have added with an interprofessional education, we have developed a module for it. And the pre and post test we have conducted, ma'am. That's the one thing. And the one more electives we have done it for a point of care testing. For cardiac markers, we have an troponin point of care testing, ABG also, which is available in our IMCU. So the students were grouped into two, and each one for an cardiology IMCU, one for an regular medicine IMCU, and they used to write a request form. I mean, request form for our the patient. Then they will present the case, and we get in feedback from the learners, madam. So this is a thing we have done in our college.
Thank you, ma'am. Any quick feedback of what are received from the faculty?
The faculty initially they hesitated to develop a module, madam. So after that, when they see the learner's face, they feel happy. So they are feel it as a clinicians. I'm a cardiologist. I'm doing this one. So that
Yes.
happiness make our faculties more enthusiastic in that, madam.
Yes, ma'am. So till now we discussed different learning strategies, and after CBME, so many changes have made, and we all have heard this common quote, that is assessment drives learning. So since we have changed our teaching methods, the learning strategies have also changed. So my question to Sangeetha madam is, what changes are needed in assessment method to test the application in clinical reasoning rather than the rote memorization?
Yes, ma'am. So I want to discuss in two aspects. One is a formative assessment, the another is a summative assessment. So our NMC more emphasizes the formative assessment, but our faculty needed training in it, the formative assessment. For example, we usually keep an internal assessment or end of this class or classroom MCQs like this only. But we have to more emphasize this reflection, peer assessment, and process skill training for a training assessment checklist and the model preparation for an integration. So for that assessment or integration, for also we should have some assessment strategy. And the clinical reasoning, we can incorporate this multiple mini interview and all. So that will makes the learner one-to-one interaction between the facilitator and also the learners. Along with we can develop an structured question for it also. So we can make it as a peer assessments also. We can do it, madam. So this is an formative assessment. Coming to the summative assessments, I feel there is a need of an uniformity in the blueprint. I think NMC given excellent reasoning to out how many number of questions and how many marks also it is given, even though some universities maybe differ. So the blueprint uniformity it is needed, I feel, ma'am. And the outcome component also we need a little bit more on the structured thing. That's thing I want to tell you. And coming to the practical, this is the angle of aspects of a theory. Coming to the practical, we all know there's a qualitative principle and procedure. We are giving some marks where the learners is going to be do it. I think it is waste of this knowledge on this procedure of doing and qualitative part or quantitative part. Even calculation, some calculations also we giving some marks. So that thing we can modify in such a way. We can introduce again this mini interviews or again reasoning skills checklist marks, some rubric we can develop for summative assessments also, madam. So these are the modification I would like to suggest.
Thank you, ma'am. Thank you for giving us different assessment methods. Now, my question to Dr. Manju, ma'am. EPA is something that we hear every day now, and we have seen so many faculty who are doing PhD also in EPA. So, ma'am, can core biochemistry concepts can be translated into EPAs?
Very valuable and very good question. Whenever we speak about EPA, that's entrustable professional activities, they are actually observable. They should be observable, measurable, and directly related to clinical work that a student can be entrusted to perform with supervision. This is actually the definition of an EPA. So whenever we speak of EPA, the thing that comes to mind is a postgraduate student, because EPAs are mainly meant for that's how it goes. But actually, it's not so. Even for an UG students, we can convert. This is a small difference between competencies and EPAs. So some competencies, certain competencies, or the core competencies with clinical relevance can be converted into entrustable professional activities, and it will be maybe 5 or 6 for the whole MBBS. I mean, the first MBBS biochemistry, we can make maximum 5 or 6. And EPS, you cannot make 30 and 40 for even for PG students. We are not able to make so many EPS. So we can, for example, if you take for a UG also, we can make an EPA. So for example, if we are dealing with enzymes and metabolic pathways, okay, your EPA that you are going to create will be, student should be interpret the given LFT or RFT or cardiac marker, you got it, or an ABG report interpretation. You should be able to interpret, reach a diagnosis. It should be very clear. That is a EPA. It can be asked as a EPA. You need not touch a patient to call it an EPA. Related to patient, clinical decision making or a critical thinking skill can be assessed, or can be not only assessed, can be we can see whether the student is able to has that capability by making EPAs related to that. Or for example, in a safe sample handling, or what is the nutritional biochemistry, can you assess the malnutrition risk in this patient, for a patient or a history we give. So such things, so related to nutrition, related to molecular biology, explain the genetic test principles, we give on clinical history. And we ask them for what is the next diagnostic sequence of diagnostic tests that you're going to go ahead in this patient. So all these things are actually, if you frame it into a proper thing, they all become entrustable professional activities. It's competencies can be made into EPS. Definitely we can do that.
Thank you, ma'am, showing us the light towards EPA. So after the CBME, there are so many changes have been done. Even they have given us how to do faculty development programs also. But what were the challenges that were faced by faculty as well as the institution while we were shifting from traditional lecture into clinically integrated teaching? So this question to Dr. Onjal sir and also to Dr. Neelam ma'am.
Thanks, Dr. Vijetha. This is again a relevant question. Challenges that we face means when all of us we feel very comfortable when we go for didactic lectures because we are in the controlling seat there. But someday we have to come out of this comfort zone. So biggest hurdle or challenge from shifting to from traditional to this innovative new ways of teaching learning is to come out of the comfort zone. For that we have to use the technology. Again, for that means we need to learn what is latest in technology because students they are more exposed to technology part. We have to learn technology, that is one aspect. And again, coming to the clinical exposure, we ourselves take a backseat whenever we talk about some clinical condition because we think at back of mind we think this is a preclinical subject. So we have to come out of that thinking and think on parts like as if we are physician or clinician, and we have to learn what is latest in the management of diseases. Or obviously the concepts are changing, so we have to learn these things. So learning is one aspect. Second is coming out of our comfort zone is the biggest challenge that I feel.
Neelam ma'am, what were the institutional challenges, ma'am?
The major institutional challenge at my level would be the shortage of faculty. Many of the institutes all over, there is tremendous faculty shortage with each and every core topic or subtopic that has been introduced by NMC, etc. You know, doing it at our institutional level with faculty that can be, counted on fingers becomes very, very difficult. So that is a major institutional challenge, and we are trying to overcome, not 100%, but yes. Number two is the syllabus of biochemistry spread over 12 months, but effectively we get 7 to 8 months. So with the rigid timetables that we have, with cutthroat, timelines where you have every 2 or 3 months, you have term, first term, second term, the prelims coming in, and all this is all very syllabus driven. So introducing that with these, the teaching methodology, the novel techniques is a biggest challenge. We are really hopeful that maybe in due time, when we'll be having ample of faculty, etc., or else the calendar restructuring, the academic calendar restructuring, we are really hopeful we can overcome. But with this limited what you say resources, we are trying to incorporate all these teaching learning methodologies.
Yes, ma'am. The faculty shortage is pan-India problem. Manju ma'am, you are already doing so much collaboration with the clinical departments also. So I
Yes.
want to know, like, how important is this inter-department collaboration, especially in achieving our horizontal and vertical integration as prescribed by CBME?
Yes. Definitely, this integrated classes that we have started, it is actually the main thing, if you ask me, it bridges the gap between our basic sciences and clinical practice. See, this when we take a session as an integrated session or a collaborative session, this collaboration between departments, let it be vertical or horizontal, it ensures that, for example, one biochemical pathway is taught along with physiological mechanisms behind it, along with pathological changes in the disease, along with the clinical manifestations that happen by a clinician. What happens is that when they are taught in continuity rather than in isolation, in silos at various times, we teach in continuity. What happens is the students are able to appreciate from molecule to bedside. If you ask me, bedside, it will strengthen their long-term retention. They see the whole thing as a as a whole one. What is called all the things in the full perspective, the disease as a full perspective, the student is able to appreciate. At the same time, when we do this, we can it avoids a lot of redundancy, and it ensures what is it called, coherence also. Lot of fragmented teaching, lot of what do you call that, repeated things that we come across, physiology and biochemistry, all those things and will be avoided. And main thing is that if you, for example, if you speak, physiology teaches osmosis, the what is it called, the transport mechanisms. But if you look at, we usually don't, definitely osmosis there, but we go for facilitated diffusion. So the terminologies used also will be little consistent if we go for an integrated teaching. And it another important fact is that the students' clinical reasoning that capability, it gets very strengthened from year one. There is no doubt for that. Integrated teaching helps them think, very clinical reasoning improves, and more than all those things, it facilitates. It's also an active learning strategy. And you're and coming to that, first of all, first when CBME introduced integrated teaching, all of us had a hue and cry telling that integrated teaching is introduced, but we are not assessing it, those topics. But now they have come up with the solution of, they are given the integrated topics also for paper 1 and paper 2 in each discipline. So even assessment is now being brought into this integrated, I mean, in accordance to integrated teaching topics. All these will definitely help to improvise our student learning, as well as make them have a little more clinical oriented approach to biochemistry.
Yes, ma'am. I mean, the CBME faculty plays very major role, right? So faculty also need some developmental programs. Other than BCME and CISP, are there any other initiatives that are needed to support this transition from traditional method to CBME? This question to Sangeetha.
Thank you so much, ma'am. Really, it is a need of the question. Even this 5 years or back, before the CBME, we never know to each other. So after the CBME only, even this panel discussion itself a one kind of an faculty development program. So like this, every month each faculty is supposed to be undergone a small thing. Even you may say this is a new concept I can introduce in my class. So these kind of innovation methods we have to be inculcate in our routine practices, because we are dealing with Zen students. So that is a one thing. And really the question paper setting and blueprinting these faculty development program we need to be adapt. And whenever we choosing the topic, we just think about the learner angle. Don't we not to think about this facilitator angle, how I can make the learners as a make a meaningful learning can be happen when I take my classes. So whenever we are choosing this faculty development topic in such a way, we can do the faculty development programs. I think it is a renamed faculty development also. It's a continuous professional development programs. So like online after the COVID, the online program is also very well need an art of this thing, and we can do monthly once as a micro CME also we can do it, ma'am.
That's why this IAME is conducting frequent online sessions to empower the faculty. So we are almost at the end of our panel discussion. Now I request Dr. Onjal sir to give some advice to our young biochemistry educators to make their teaching more clinically relevant and impactful.
I think this is very odd question for me. I am not that senior, but still, means whenever we think of biochemistry, we think this is a dry subject. Obviously, at back of my mind, I think we all think that this is a preclinical subject. But whenever we teach biochemistry, we have to change our thinking. We have to teach them the clinical biochemistry. This is one aspect. Second is, instead of teaching like a biochemist, we should be teaching them like a clinician who deals with the knowledge of biochemistry subject. So whenever we prepare the subject or teach, we should always ask three questions. So what I am teaching, is it clinical biochemistry? Second is, why this biochemical topic is important for understanding disease. And third is, how this biochemistry topic will help in disease management. So with this background, the students will get engaged. They will develop some curiosity because this is relevant. This is relevant to the patient management or the it is relevant in the clinics. So this is in short, Miss. In summary, I will like to say this is the coherence of biochemistry and medical sciences.
Thank you, sir. Neelam ma'am, what are the key takeaways to our audience who are online joined us online?
Yeah, I just wanted to add what Dr. Onjal sir has said. I mean, biochemistry should help the students to interpret all your lab reports, the written reports, they understand the disease mechanisms that are underlying. And of course, in the long run, they should make rational clinical decisions. So we should not crib on, small programs, small time, small changes, one case, one report, one clinical discussion, then this can transform learning. So maybe this is the thought process of everyone who is attending our panel discussion, and that is why such huge number of participants are there. So thank you so much.
There is a question from audience. Sangeetha ma'am, would you like to take this question? How would you suggest we engage all 150 to 250 first year MBBS students in research, as was recommended by NMC CBME 2023 guidelines?
Ma'am, research, it is not in one day or in 1 month. It is needed some experiential thing. As a mom, first year students, what in their level, what they can do in a research, writing an objectives, choosing a topic, and we can just give an overall idea. For example, what we used to do in our class, we just shared this ICMR guidelines, STS projects guidelines to the students, and we have shared 5 to 10 articles to the learners. So from that, they can choose the articles. Interest of their own. For example, for anemia related some studies and thyroid related some studies. So they will choose one journals, and in the journal, based on this ICMR protocol, what is the title? They have to explain in their own words, and what the objective of this, and what methodology it is followed, and what the study participant in this. So final discussion what it is. So finally, end of this activity, they know what are the subheadings for the research and how to make a title. So up to the uh, first year, they may clear with these concepts. I think it is enough. For example, if it is a 250 students, we can give 25 articles related to in antenatal mothers and biochemistry, and whatever the specialty, whatever topic we have covered, we can share with the journals, latest one, or it is an old one also. It's no issues, madam. But it should be covered in this ICMR protocol subheadings at least, I feel.
Thank you, ma'am. Thank you for answering that question. So now we are almost at the end of our panel discussion. And on behalf of IAME, I extend my sincere gratitude to all our esteemed panelists for their scholarly insights and thoughtful deliberation. The discussion has effectively highlighted the integration of core biochemical concepts with the clinical practice, research orientation, and professional values. And I also thank all the participants for their active engagement and interest, which greatly enriched this academic discourse. So we deeply appreciate the collective contribution of everyone who is involved in making this session meaningful and impactful. Thank you, one and all.
Thank you,
thank
IAME,
Dr.
for this.
Vijetha first. And I would like to extend my thanks to Dr. Vijetha, who has moderated this 1.5 hours session in a very wonderful manner. Thank you, Dr. Vijetha,
Thank
and
you
also
so much,
thank
ma'am.
all my co-panelists to effectively take part in it. Thank you so much for giving me this opportunity. Thank you.
Thank you,
you all,
IAME,
madam.
for this opportunity. Thank you, Dr. Vijetha, for wonderfully moderating this session. Very thankful to Dr. Sangeetha madam, Dr. Manju madam, Dr. Onjal sir, and thanks everyone who has attended this panel discussion in such a large number. Thank you.
Thank you, audience. Audience, thank you so much.
Heartwarming thanks from my side also.
Okay. So I will close the meeting. Thank you, everyone. Have a good
Thank
day.
you. Thank you. Thank you all, panelists. And Vijetha madam also.